Hi, my name's Phil. I like talking about politics, and in this video I'd like to discuss the latest from the ongoing court action against the government for their corrupt handling of the PPE crisis last year. What essentially happened, why it's more important than I think even those opposed to the government's handling may realise. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So the Good Law Project and Every Doctor UK are currently in court against the government over the corrupt PPE contracts with companies who were not suppliers of PPE, whilst at the same time the government were ignoring calls from actual PPE manufacturers and suppliers. And this point cannot be made strongly enough. The government tried to claim that PPE shortages last year were because of sudden, unexpected and huge global demand. And if you read nothing around the matter, well, that sounds reasonable. Because after all, well, the pandemic did seem to be sudden. Of course, it's going to create huge demand on PPE. Yes, you're going to get caught out. It's going to be difficult to get it. But it's not. The government do not get to claim that they were unable to source PPE quickly when British-based suppliers of PPE were publicly saying that they would prioritise any NHS contracts that came their way. They just didn't get any. Arco, who are a huge PPE supplier in the UK, have published a document which sets out how things unfolded from their point of view, which I've linked in the description below. Essentially, we had access to a huge PPE supply chain that we completely passed over in favour of the so-called VIP lane. You know, the mechanism by which the government used the pandemic to funnel vast sums of public money into the hands of mates and donors who said that they'd get the PPE. Now, it's a bit like this. So, if I'm assuming you're not a PPE supplier. If you are, ignore this bit. But if you or I wanted to supply, say, surgical gowns, for example, to the government, you know, we won't be able to do it. You know, if a contract came up from the government for surgical gowns, we couldn't fulfill it. I mean, yeah, we can find manufacturers, we could put in orders, sure. But without experience, without an established network, we wouldn't get a good price. And so we couldn't possibly fulfill that government contract at a price that would be good values for members of the public. In other words, we couldn't possibly make a profit out of it. But let's say that the government said that they would pay over the odds. Well, then it might be possible, because now you can buy the stuff at above the market price, pass it on to the NHS, and the government would pay you what you paid plus a hefty amount on top to make it worth your while. Thanks very much for that £50,000 donation to the Conservative Party a year ago. Here's a contract that will net you personally £500,000. And that was bad enough, because that meant that we were paying over the odds for the PPE. Yes, the average price would have gone up during the global pandemic, but we paid well over the odds for the PPE. If we just used our own normal procurement processes, we'd have still had the same equipment, but for a lower sum. But there was an even worse side of it, because that is just we're paying too much. And of course, all that's going to end up on the national debt and we're going to have to pay it off for the rest of our lives. And so are people who are still too young to even be able to vote at the moment. But there was a worse side to it. So let's say instead you've got a Tory friend or donor doing the same thing, but they were especially greedy. £500,000 on top's not enough. So they try and cut costs, because obviously if you can cut costs, then you can make even more of a profit. So you try and source that PPE from dodgier sources, you know, less reliable sources. The consignment arrives eventually, it takes a long time, and it isn't what was ordered. But the Tory friend or donor doesn't lose out, because this isn't about sourcing PPE. It's like a good old-fashioned gangster front. The whole purpose of this VIP lane is to reward, well, the VIPs, the donors, and those who just want to feather their own nest. There are an unsurprising number of government ministers, for example, who have a personal stake in some of these companies that didn't exist before the pandemic. They were made during the pandemic, who were given these and other pandemic-related contracts, including the Health Secretary, Matt Hancock. Well, he's got a nice little family business that's just been set up for this, and it's his department that awards these contracts. In one document shown in the court case, an official sent a note, an email, saying that they were drowning in VIP requests and what they called high priority contacts. What was happening here was, in the Tory gold rush, friends and donors were bombarding ministers, including the Prime Minister we now know, for preferential treatment. Oh, can I get in on this? Oh, I could do with a new mansion. Can I get in on this? The ministers were then bombarding their officials with these requests, who simply couldn't keep up with the tsunami of cronyism coming their way. The note makes clear that these contacts do not hold the correct certification or pass due diligence. Of course not, because they were t-shirt salesmen or rat catchers or pub landlords, or even just some guy who has no discernible profession but plays the odd game of golf with a Tory minister. Or maybe they just were a Tory minister. It was a trolley dash on the country's money, because what happens in a genuine emergency like this? People understand you're going to have to spend a lot of money, and they also understand that in your haste to manage the situation, mistakes will be made. A competent government would have made the odd slip. A competent government would have had to pay a lot of money. This gave the Conservatives the perfect cover to spend vast sums of our money in a way they knew would not deliver. Well, it delivered for them, but not for us. If you attack the amount they've spent, they will say that they make no apology for doing everything they could to deal with the crisis and save lives. This indeed is what Boris Johnson did with the James Dyson scandal this last week, of which I may have more to say this weekend. But not a single life was saved by Johnson's actions there, because not a single ventilator was supplied. But they will keep up with the lie anyway, because it will work on some people. Arguably, enough people. And if you don't bother attacking the cost and instead you turn your attention to the fact that the money didn't result in anything at all in many cases, or it resulted in boxes of equipment that weren't correct, weren't safe, and at times were past their expiry date, then they will say, well, the sudden emergency meant that we had to act quickly, and of course there's always going to be the odd little thing that slips through, the odd mistake. This is despite the government a year ago claiming that the reason they were acting so slowly on acquiring the PPE was so that they didn't make mistakes. When they were tasked a year ago with, why is it taking so long to get this PPE? Well, we have to be careful. We have to check everyone out. We have to make sure that what we're ordering is what we get. But then it didn't. That didn't happen. We didn't get what we ordered. So in reality, it's all because you don't give contracts to established suppliers. Instead, you give them to friends and associates who have no experience of PPE procurement. And of course, there are going to be delays. They've got to try and Google where the hell you get surgical gowns from or face masks, in the middle of a global pandemic, because they haven't got a clue. They don't work in PPE. They don't have a business that supplies PPE. They've just made one that morning. But the problem is that too few of the public consider all of these things at once. It's so huge. Each argument in isolation seems reasonable. Oh, why did it take so long to get PPE? Well, in the middle of a global pandemic, our normal supply lines are a bit cut off. We've got to try and find other sources. We've got to check that we're going to get what we ordered. Well, that sounds reasonable. We didn't get what we ordered. Oh, well, in our haste, of course, if you try and get the PPE quickly because the NHS were running out, we had to get it quickly. There's bound to be the odd thing that slips through. We'd make no apology for that. Well, that seems reasonable in isolation. You're spending vast sums of money here, well over the odds. Well, global pandemic, huge demand. We had to spend a little bit extra to make sure that we could jump the queue and get some of this equipment. That sounds reasonable. Each one in isolation sounds reasonable, but they don't make sense when you put them together because they contradict each other. But the average member of the general public who doesn't understand about medical procurement any more than a t-shirt salesman would, and they'll buy it. And the enormity of the corruption here can often mean, I think, that we're distracted from what is the real problem. This is corruption on a scale not seen in my lifetime in this country, in any living person's lifetime, I would imagine. But I think it's important not to lose sight of what is the human cost here. as a direct result of not supplying the PPE that we know the government had the capacity to do if they wanted. Our NHS and care staff did not have sufficient protection from the virus at work, whether that be in hospitals, clinics, care homes, wherever. Because of that, staff contracted the virus. And the reason why such a high proportion of NHS staff now have long COVID is just likely due to the sheer scale of the viral load they were exposed to. Most people in the country, if they became infected with COVID, they'll have picked it up inadvertently in the office, on a bus, in the shops, maybe at a hospital. A relatively brief breathing in of infected air. Healthcare staff will have been bombarded with it all day, every day. The dose will have been much higher, and so the long-term consequences much more likely. And given that these staff were also caring for some of the most vulnerable people in society, they will have passed on the virus to the very people least equipped to deal with it. This has led directly to a number of deaths that I couldn't even guess at, as well as the fact because it overloaded the NHS system, there's a load of other people weren't getting other types of treatment as well. It's also killed NHS and care home workers themselves out of proportion to the general population. This government, because of its greed, not incompetence, this is greed, has killed people and left many NHS workers with long COVID. And that is the powerful moral outrage here, much more so than the corruption, I think. But then there's the practical side of it too. Because of this policy, lots of NHS staff were, at any one time, off ill or isolated. That meant that the remaining workforce, which was already badly understaffed, back to the tune of about 100,000 after 10 years of Tory rule, was stretched even thinner. That makes them even more exhausted trying to do the work of more people, running their immune systems down, making them more susceptible in turn. And now that over half of them, well over half of them, have long COVID, according to reports, this is with us for the long term. This doesn't go with the pandemic. Our healthcare system is going to fail even more rapidly now. It's no longer as simple as saying we're tens of thousands of staff short in the NHS, because now even that number is much greater when you consider the number of staff who are going to be absent or at least not working at full strength because of long-term debilitating effects of long COVID. And as for the court action, I hope it has some impact. I doubt it will have any legal consequences for the government, but I do hope we at least get some political ones. But those are my thoughts for now. I hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.